struggled. Stacey knows I've struggled. I had a very, I had a breakdown in December. I mean, our numbers were high. And I saw everyone struggling with just taking care of COVID patients. Was very taxing and very difficult. We're still talking about it to this day. It's pushed me to seek therapy and actually to go on anti-anxiety medication. And for the first time, I think we both use sleep aids now to sleep. She had to like kind of just take control of our family unit, and we were able to keep ourselves safe. But that was, it was just us, like just the three of us. I mean, she comes from a line of nurses, so her older sister is an ICU nurse, and the middle sister just became a nurse practitioner. And
her wife's a OR nurse.
Yeah, and then her wife's an OR nurse. So, and we all talk about it, and we talked about it during the pandemic, just the struggle. And then I think the best way that it's been explained to me is, when I went to the doctors recently, was my doctor told me, well, Monique, you ran on adrenaline. I took my hospital out on a protest. We went on strike for 10 days. I led that strike. I emceed that strike for short staffing, and it was just battle after battle. You saw things being taken to the streets. You saw the
hospitals took advantage.
Yeah.
Even when they weren't filled with COVID yet, because Newsom said that nurses were allowed to go out of ratio in California if you were swamped with COVID, but her hospital wouldn't do that. They would put them out of ratio when there was barely COVID in the hospital.
Yeah.
They just took advantage.
Yeah. And it's like,
you just shined a light on the hospital.
Yeah.
Greed.
In 2020 showed us all of the disparities and all the shortcomings everywhere. So everything was in your face, constantly, right? Mm-hmm. And it wasn't anything we didn't know already was there. We knew that there's been a nursing shortage forever. The problems were very more visual and in your face, I think, with people just taking that downtime. It was definitely difficult and taxing. And I think we haven't even scratched the surface of recovering from the trauma, to be honest. We're still just kind of trying, especially those nurses that, like us, we don't travel, right? We're not travel nurses. And I think, I don't want to say every single nurse, no matter what field you are in, you felt, or whatever specialty whatever area you are in patient care, you endured trauma from last year, no matter what. And no one's trauma trumps the other, kind of trauma. You saw, yes, ICU saw their type, unprecedented deaths and unprecedented numbers, but you're looking at your med surg floors too, where it's, they're not used to so many codes in a day, or, hey, 2 out of 5 of your patients passed away in one shift, that's kind of unheard of. So it's dealing with that, and it's I said, we haven't even began to scratch the surface of the trauma that we felt and we went through last year. And my biggest fear is now looking at the numbers of, we have all these vaccines available, but a lot of people are not getting them. Right. I fear a surge come the winter time, and where does that leave me and my coworkers who were barely kind of hanging on, and we're hanging on to each other.